EVMS was started by the community, for the community. In the early 60s, some very bold community leaders said, we need to have medical school. So they literally raised the money from the community to start a medical school.
Most medical schools are not started by community leaders, but the community leaders understood how important it was to bring better quality care to this region.
I ended up waking up in the emergency room and had emergency surgery. It was as if my donation earlier, which had been for my coworkers, was paying off right in front of me. Look at these wonderful people. Look at these wonderful clinicians, these healers that we have.
EVMS actually, to me, means life. I had had a massive pulmonary embolism. Apparently, I kept telling the emergency room doctor, I can't breathe, don't let me die. They said it was a miracle because in 3 weeks I walked out of the hospital. A lot of the doctors who treated me were from EVMS. So to me, it's kind of a community family. We're the EVMS community. We're a family. We're a family that supports each other.
We train students to be good doctors and other health professionals, not just MDs. But we also see patients, and we also do research. So all these things are going on. 3 things. We're teaching, we're discovering and research, and we're taking care of patients.
I owe a lot to EVMS because of my son. I had been trying to get pregnant for 8 years. Everybody understands that the Jones Institute is the place to go. I mean, it was the first place in the United States where in vitro was founded. Without that in this region, I look at the playground and wonder how many of those kids would not be here without that.
What inspires me is the fact that we're giving to the people that actually are the value and the assets for developing the educational programs and research programs to develop this institution into its future.
I love to be an educator. We've created an environment that cares about their success, and it's not just a job for me, it's something that I invest in because I believe in it.
And it's just the people primarily. And the students that I've seen graduating and participating, there's an emphasis on quality care, not just the technical aspects, but the personal aspects that seems to permeate throughout this place. It's not just learning how to do things, but also how to treat people.
It's not just a job, it's their lives. They're involved in health care. And so we're making Hampton Roads a healthier place. What a great investment. What a good thing to support.
When you're a member of a community that you believe in, that you have a responsibility to invest in it.
I think we have a great mission here at EVMS in all of our dimensions, in education and in research and in clinical care. And I'm hoping that people can join in supporting that very, very noble effort.
By giving back to EVMS to allow it to continue on is rewarding.
You have a certain number of philanthropic dollars. You have a certain amount of money you're going to give away to somebody, somewhere. Why not take that dollar you're going to give to somebody and put it right where you're working, make it a better place?